Okay, so we're going to demonstrate what to do in case one of your patients has a seizure. Our scenario this time is I have little Ella Sanders. She's in today for her 2-year-old well baby check. I'm in the process of getting her head circumference, her height, weight, all of her vital signs. And while I'm doing that, she's also had a fever for the last couple days, and she's got a fever today. That's what her mom reported to me. So while I'm doing that, all of a sudden, what happens is Ella becomes real rigid, and she starts to kind of shake. Ella,
what are you doing? What are you trying to make me do? What's going on?
she's okay. You need to step back for just a second. And what I want to do is I want to make sure while Ella's shaking that I protect her head, and she should in this case because she's an infant already has no clothing on. But if she had tight restrictive clothing, I would want to try and remove that. So the patient is going through a seizure episode. So while she's shaking, there's nothing we can do. We just can let mom know it's going to be okay. Hang on just a second. I'd maybe want to have somebody call for the provider while the patient's going through. I do need to note the time the seizure started so that I can document that, okay? So my poor Ella. It's okay, Ella. If Ella starts to excrete anything from her mouth, which sometimes patients do. Sometimes, most of the time when a patient has a seizure, they will soil themselves, okay? She's got a diaper on, so we're good in this particular situation. But a lot of times they will soil themselves, or they may start to have something run out of their mouth. In that case, I'd want to turn my patient over in the side so that they don't aspirate. They don't choke on whatever is coming out of their mouth. All right, so Ella's done having her seizure. She kind of wakes up. She kind of starts crying. It's okay, Mom. She's going to be fine. The doctor will be in just a second. And I've kept my patient safe by making sure she didn't fall off the table. I protected her head, and I just let the seizure happen. I don't restrain her. The only thing I might do is, again, roll her on her side, and again, protect the head while she's maybe having that convulsion, okay? This does need to be documented as well. So the documentation I would want to do is make sure I always start with my patient's date, time, what was happening, how long the seizure lasted, what I did. So again, that the whole incident or the entire episode was well documented.